Welcome to Baby Snugs and Coffee Mugs. I'm Krista.
And I'm Kelsey. We're both labor and delivery nurses from Minnesota. In this podcast, we'll be covering all things pregnancy, delivering in a hospital, and caring for yourself and baby postpartum.
This podcast is meant for educational and entertainment purposes only, so please seek medical advice from your healthcare provider. We are so excited for you to join us, so grab your coffee, snuggle up, and keep on listening.
Cheers!
Cheers! Welcome back, everyone, to episode 5 of Snugs and Mugs.
Welcome. This week we have something a little bit more exciting, not so informational. It is the packing list.
Ooh, what should you guys bring to the hospital?
It's a good question because people bring mountains of suitcases with. So our goal is to, reel that back, let you know what we have for you, and let you know what we think you should bring.
Yeah, exactly. Reeling in the over and under packing, kind of getting that sweet spot for you guys.
So let's start out with car seats.
Mm-hmm.
Let's just be real here. Car seats are a big deal. We want you coming to the hospital to have that base installed. So not all of our nurses are certified installing car seats. So we want you to be reading your manual of not only your car seat, but of your car. They both give you instructions of how to install that. If you're not figuring it out, most fire stations are certified in it. Mm-hmm. There's also car seat classes, I believe, in your community. Just look it up. Yep.
You can also ask your clinic, ask your provider, say, hey, we just want to make sure on this car seat we're not 100%. Do you guys have any resources for car seat certified people that we can get in touch with? So just making sure.
Yeah, absolutely.
Mm-hmm. Personal suggestion, I think that by 36 weeks, you should have that base and car seat figured out, installed, ready to go for the hospital.
I agree. What about packing? What'd you do with your girls in packing there, Krista?
Okay, so do as I say, don't do as I do, right? So with my first kid, I definitely was a little more ahead of the game. I think I did it around 37 weeks. I got to full term and I was like, okay, we can pack our hospital bag. Obviously leaving out things that we still needed to use at home. But I'm pretty sure my last one, it was the day before my induction. So, I wasn't really ahead of the game on that one, but
I guarantee every mom out there that has multiple kids is going to say the same thing.
Yeah, most likely, right? There's always those type A people though, that are way ahead of the schedule.
That's true. That would possibly be me.
Yeah, but it's not me at all. If you guys will learn anything, I am not type A. I am late to everything and last minute, and I procrastinate. So.
All right. Well, let's talk about what to put in that bag.
All right. So we're going to start out with the mama.
All right.
So just starting out, first thing, you're going in, you're in labor. What are you going to wear in labor? So obviously the hospital has a gown for you to wear if that's what you guys want to do. But there are so many options out there of laboring gowns that you guys can get. I've seen patients that have ones that have snaps down the back for the option of an epidural. They have openings on the sides for the monitors to go in place. So there's all those kind of cute little gowns.
Super cool. They're, I feel being suggested everywhere, and just know that it might get messy.
Yeah, it will most likely get messy.
So if you don't want to spend the money on something that's going to get ruined, just go with our hospital gown.
Yeah, fair. Which brings us to bras. So personally, I wore sports bras in labor. I literally wore the sports bras, the belly bands. That was it. That was my labor outfit.
Keeping it easy.
Again, knowing that my sports bra was going to be ruined and it got tossed out afterwards. And then I switched into a nursing bra afterwards because I chose to breastfeed. So making sure you're bringing some sort of nursing bra. If you don't want to do the bra, you can do a nursing tank top. Something with easy access for baby to obviously get feeding. If you guys don't plan to breastfeed, we suggest bringing a supportive sports bra or tight-fitting bra that can kind of just help compress the breasts a little bit. It can kind of help control that milk from not coming in as much and just help with your guys' comfort because you just kind of have to tell your body to not make the milk if your plan is to formula feed.
Yeah, I completely agree. So it essentially is trying to decrease stimulation to get that milk to go.
Exactly. Bringing some clothes for you. So you are more than welcome to wear the hospital gown while you are there for your stay. Obviously, you have to go home in something, so you're going to want to bring something at least to wear home. But I also see people bringing like another comfy outfit depending on how long you're going to be there. Some comfy PJs. Personally, I wore a robe after 2 of my deliveries, and I wish I would have done it with my first because I just thought it was so comfortable to just be in a robe. Easy for skin to skin, easy for feeding, and they're comfy. Like, easy.
I mean, I live in a robe at home, so I would get that.
Exactly. And like, I think that's the biggest thing is you want to be feeling as much like you're at home as you can. So like going into this, like, I want to be comfortable. I want to have my home stuff with me, but just not an overwhelming amount.
Mm-hmm.
So bring in some robe, PJs, whatever you guys want, and then something for your feet. The hospital floor is gross.
Please bring something for your feet.
It gets clean, guys. It gets clean, but it's still gross. It's a hospital, right? Let's be real. So personally, I did flip-flops. People bring Crocs, some sort of slip-on shoes, knowing that potentially, like, if you're wearing them right after delivery or while you're in labor, they, again, could get ruined. So I think wipeable surfaced shoes are best, but, something to wear on your feet. Then you're going to want to bring your own toiletries. So, I liked my own shampoo, my own conditioner, all my face products. Like, I brought my own makeup, toothbrush, all that kind of stuff. Again, not everyone wears that or does that kind of stuff, and that's okay. But just thinking of those things that obviously, like, the hospital's not going to have a bunch of makeup for you guys, right?
Yeah, it gives you a little more comfter.
Yes. So I'm like, I wanted a fresh face the day after. Like, I wanted to feel like a normal person and not like a wildebeest after my delivery.
Oh, I'm all about makeup, so I get it.
Okay, and then something to tie your hair back, guys. This gets forgotten, and like there are times where yes, we do have some hair ties for you guys, but there are times where I'm like, I have a rubber band. I'm so sorry, that's all I have.
Mm-hmm.
So like a claw clip, a scrunchie, hair tie, whatever you want. You're gonna want to be comfortable. You're most likely gonna get sweaty, and there's blood, there's fluids going places, so you're gonna want your hair tied back.
Just start with your hair back, you guys.
Yeah,
that's what my suggestion would be.
Yeah, definitely same. And then thinking about how you're going to labor and deliver. So if you're planning a low intervention labor and delivery, ask your clinic if they know, or try to get in contact with the hospital. Maybe if you have a tour, ask them, what do they have for supplies? Do they have aromatherapy? Do they have distraction things? Do they have other options for you if you're planning low intervention? And knowing what they have can kind of guide you with what you should bring. So if you get suggestions from friends, you know things that already worked for you. If you already do some sort of like deep breathing, some sort of distraction therapy, or whatever you might do at home that you know works for you, bring those things with you. It's always good to have more options and not need them than the opposite and be like, oh no, I wish I would have brought this because I felt like maybe that would have worked better. And then colostrum. So I feel like I have quite a few patients who say they've leaked in pregnancy or that they have been leaking and collected some of that colostrum, which is your first breast milk that you make. Bring it with you. It takes a couple days depending on your baby and the person and your situation. It can take some time for your milk to come in. So you're only going to get benefits from bringing in that colostrum.
That's such a good idea to bring that.
Yeah. Make sure you label it. Obviously, we have labels for you. So at least even like knowing when it's from, how to store it, you're going to have to look all that stuff up. But like, bring it with you, and especially while we're waiting for your milk to come in, we can give that to your baby, and all the colostrum the better. So that kind of, I think, covers the list of things that we think you guys should kind of bring in. So small list of the things that we know the hospital will provide for you guys. So we'll start off with peri supplies. So that's everything for your bottom area after delivery. So you get super cute, stretchy granny panties.
Victoria's Secret.
They're very comfortable, though. I will say from experience, they're actually very comfortable after you push a child out of you, right? So we have the undies. We have pads for you guys. Our hospital has 2 different sizes. We have ice packs for you. We have these really comfy witch hazel pads. They're nice and soothing. We have a Dermaplast spray, it's called, for kind of burning and itching.
It's more of like a numbing spray.
Yep, exactly. And then we have a peri bottle. So again, you can have all those things at your house. You can bring them if you're dead set on a certain brand, but we have all those things. So like, use our supplies.
Save your money.
Yeah, they're already included in your hospital stay. Like,
yep.
Just use ours. And then if you are planning to breastfeed, we are going to supply breastfeeding devices, supplies, all that. So if you get sore nipples, we have nipple cream. We have gel pads for your nipples, nursing pads, a nipple shield if you need that to assist with feeding, and then breast pumps. All hospitals will have some sort of breast pump for you to use. So all those kind of breastfeeding things that you might need should be provided. Other things the hospital will have is medications for you after you have the baby. So things like Tylenol, ibuprofen, stool softeners, prenatal vitamins. Most medications that you're even prescribed, the hospital should have. There are obviously some out there or different or rare medications that the hospital may not have, and you might have to use your own, and then you can discuss that with them when you are there. But the hospital really should have most medications that you're going to need and that you take. And then the hospital, again, if you end up taking an ambulance, you go there really quick because things are happening fast and you forget a bunch of stuff. We have hospital socks, we have toiletries. They're just all super generic. So it's not obviously the greatest deodorant or the best toothpaste, but like it works.
Yeah, so I mean, guys, if you want to be an underpacker, we probably have what you need.
Yeah, we can have all those generic toiletries, like 2-in-1 shampoo, probably 3-in-1.
I was to say, it is
shampoo,
all over body head
wash.
to toe.
Not sure if there's conditioner in there, guys. So those are the things that the hospital will supply for the mom. And that brings us to baby, which I think is the more exciting thing to pack for. So I'm going to start with my personal favorite thing to pack for the baby is their going home outfit. It is not necessary to make your going home outfit a big deal. I am just one of those people, okay, guys? So not knowing the gender of my baby, I just felt like, or any of my babies, I just felt like it was exciting to like pick their outfit because like I knew that. Like I knew what their outfit was going to be. I didn't know who they were going to be, but I could decide on their outfit. So getting that going home outfit picked out, and personally I would bring a second outfit. Babies are messy, they spit up, they poop, they're breastfeeding, there's again fluids, there's things happening, so it's most likely going to get dirty. So I would bring a second outfit if you want that baby in another outfit. If you're having a planned C-section, you might be there for 3 days, you might want to bring more than one extra outfit. So just bringing yourself a couple options if depending on how long you're going to be there.
Yeah, as long as you're saving that going home outfit for going home.
Yep, so right before you guys leave, you just put that baby in that cute little outfit, take your pictures, and out you go. Bring your baby a hat. So personally, I think doesn't matter what time of year, Minnesota, especially where we live, doesn't get that warm. It's windy, and they lose so much heat from their head. So keeping that head warm is super, super important. Depending on your outfit you're putting the baby in, making sure they have socks and then mittens. So a lot of onesies and sleepers and things have those fold over little mitten cover, hand covers for the babies. But not all of them do. So if they do not, I would bring some little mittens for the baby because their nails are so long when they are born.
They scratch their faces so much. Yeah. And I will say one of the main questions is if we have baby clippers for the babies, and we do not. You guys, it's a safety thing. Their little skin on the tips of their fingers are so fragile. So you're just covering their hands for a few weeks at least.
Yes, definitely. I think I did it for a month with all of my kids just because I don't like to clip their nails. I made my husband, you guys, this is ridiculous. I'm a nurse and I'm like, I can't. I'm so nervous. And like, I would make him do it because like, I just was so scared I was going to clip their skin.
Yeah, but which is why we don't do it at the hospital.
Exactly. Making sure you have some sort of blanket and or car seat cover. So again, we live in Minnesota. It gets cold in the winter. So I had this nice Eddie Bauer cover that I liked over my car seat. It zipped up, had a little flap where their head is, protect them from the wind and the cold. So something like that, depending on the time of the year, like a blanket to go with it, and then a swaddle blanket. Personally, I like the swaddle blankets that are a little stretchier that you can bring from home. I like the muslin ones. They're nice and soft and they can stretch and get a little tighter around the baby. So I think that's kind of my best suggestion for the blankets.
And I have just a weird tip for blankets. So babies have to sleep in bassinets at our hospital. I think that's a standard for every hospital. They don't like our bassinets. It is just a known thing.
No, they hate it.
No, they were nice and comfy in their mom's belly. That's where they want to be. So a lot of my friends, I tell them when they're pregnant to sleep with a baby blanket that they're going to be bringing to the hospital. So then when they swaddle their baby and put them in the bassinet, they still get that like nice strong smell from mom. And
that's so smart.
I think it makes a difference. Yeah. It might not every time, but it is just one of my little tricks that I'll throw out there.
Yeah, that's a good idea, guys. You should definitely do that. It's not going to hurt.
Definitely. It's not going to hurt.
If you have a pacifier that you want to bring for the baby, definitely feel free to bring your own pacifier in. And then anything that you want of your own brand, again, bring that kind of stuff in. And then the fun thing, so like if you have like one of those little letter boards that you want to bring in, or a little name sign that you fill out, a baby book that you want footprints in, kind of those fun mementos, make sure you guys bring those in. Definitely pack those right away because you're obviously going to not need them until after the baby's born. I just know I've had patients that are like, oh no, we forgot the baby book, and they're just so sad about it, and I just feel so bad. So yeah, put those in the bag right away, guys. So things that our hospitals are going to have for the baby. So they will have diapers, they will have wipes, they're going to have stuff for the first bath, so soap, they're going to have lotion, they have Vaseline if you plan to circumcise the baby. Otherwise, a lot of people I see use it to help with those first few poops that are just so sticky on their bottoms, so it can kind of help so they don't have to wipe as much. Bulb syringes, baby blankets, burp cloths, little t-shirts. If you guys are planning to formula feed, the hospital will supply formula. With that being said, there are obviously certain brands of formula that we don't have. We provide Similac. Obviously, other hospitals might have something different. So if you have a specific brand, guys, that you want of literally anything, formula included, go ahead and bring those in and just let them know.
Yeah, I've had multiple patients do that.
Yeah.
It's just what has worked for them and their past babies, and that is totally fine.
Yep, exactly. So that kind of wraps up the things that the hospital will have. Again, I just want to reiterate, guys, like if you have any questions, either ask your provider or like have them get in contact with the hospital so that you don't have to bring things that you don't really need. So
exactly.
Yeah, so that wraps up baby, and then I think we're on to the support person.
Yeah, so you typically have somebody with you, so you're packing them a bag as well, or, coordinating everybody's into one. But comfy clothes, same for you. You're there for a couple of days at least. You want to be comfy as well. Going on to the shoe thing, again, yes. Please wear shoes, so whether that's slippers or slip-ons.
You guys do not walk barefoot in the hospital.
Support person either.
None of you. I don't want to see it.
And then same thing, toiletries if you just want your stuff to make you more comfortable. And then a water bottle, absolutely optional. Moms typically get a nice mug. They do from our hospital. I think that's pretty standard for other hospitals. But just preventing walking out to that water fountain a million times a day if you can make it work.
Especially if mom does not want you guys out of the room. We can go fill your water bottle for you. Don't get me wrong. But.
Yeah, absolutely. Okay, and then one little thing that we're going to add to it is for the support person, the father of the baby, to bring in a picture ID. If you guys are not married, there's going to be a separate form that you guys have to fill out to make that legal. So again, super common for people not to be married these days. Yeah, just have that picture ID. Totally fine.
Mm-hmm. We don't need the moms. We know the baby came from you.
We know who you are.
Yeah, we need no verification for you. But yes, if you are the father of the baby and that is your support person, bring your ID in.
Yep, exactly. And then just, a generalized list of things. Phone chargers, number one. First of all, pack it going home or going to the hospital, also pack it going home. Yes. Everybody always forgets it.
All the time. People forget their phone chargers all the time at the hospital, you guys.
But just a little side note on the phone charger, there is never an outlet near your bed. So if you have the capability to get an extra long cord, it is very useful for everybody.
Yep.
Next thing on our list is a pillow and blanket. Again, hospital laundered. It is not as comfy. A lot of people like to have their own blanket. Again, it can get messy, so if you don't want that, that's okay. Or if it's something that you're okay with washing.
Or just move it for the delivery.
Or that.
Yeah. And then you can use, just use it after the delivery, really, more than anything.
Yes. And then our pillows, of course, are plastic because they need to be able to get wiped down. So,
guys, they crinkle.
They have a noise. They have a sound.
Under your head, okay? It's not comfortable.
Bring a pillow. You'll be much more comfy. Okay, this is leading us into snacks. We do have a little bit of snacks on our floor. It's nothing crazy, so if there's something that you really like, especially like granola bars or some kind of like beef stick, something protein-wise, keep those in your room, especially if the support person isn't able to leave for a period of time. It gives them a little extra fuel too.
And we have a patient fridge, so like if you guys bring something or you order something or wherever it might be, and like it needs to be stored in a fridge, like we have a fridge where we can label stuff, and I would assume most hospitals have that. Some of them probably even have fridges in their rooms. So know that it doesn't have to be all like out of fridge items. There is a place to store.
Yeah, such a good point to add to that. Yeah. Absolutely. And then leading off of the snack thing, bring money, cash, debit card. Most places have a cafeteria. You can also order in. Mm-hmm. Jimmy John's.
Yeah, definitely get the Jimmy John's, you guys. I've got it every time. You're going to hear this like 400 times in this podcast, but get her Jimmy John's because she wants Jimmy John's.
These next couple of things, Krista actually added to the list. It was beneficial for her, a little night light, just so it's not bright in that room, especially at night when you're getting up throughout the night feeding baby and, going to the bathroom. We added a sound machine to the list. I learned recently that babies in utero hear the sound of a vacuum going at all times. So, they're coming out into the world and all of a sudden it's dead silent in the night. They're not going to love that.
No. It makes them uncomfortable, guys.
Yeah, I'm a huge fan of sound machines, so add that to the list if you have it. I know a lot of iPhones have a sound machine built in, too.
Yep, or you can, if you have Apple Music or Spotify, whatever it is, you guys, you can play.
So, again, you do not have to pack this, but it is a nice little added bonus. Also, a small fan. I know our hospital has a handful of fans, but they're not always there for you to use. So
we only have so many, so.
Yeah. A necessity, in my opinion, is chapstick. I carry chapstick in my pocket for my entire 12 hours at work.
It is so dry in the hospital.
It is so bad.
Yeah.
So we do have chapstick, but if you have a favorite, I would just bring it. Mm-hmm. Have it with you. Have it at your bedside. And then a few things that we added just in case you're there for a few days. So if you're being there to be induced, if you've had a C-section, you're there a couple extra days. So a Fire Stick is always a good option or some form of that. Bringing in your laptop, bringing a card game, something to kind of just keep you occupied and pass that time. Final thing is if you want to make a fun playlist.
Please do it. Your nurses will love it.
I love when patients make playlists, and I'm always asking what they are called. Bring in a speaker. We also love that. It is so fun. It just kind of makes it personal. And
I had a family recently that every other song on this playlist was Taylor Swift, you guys. And I had the best time of my life. I was like, this is amazing. We like the same music, guys.
Yeah. Every time I'm like, can I just hang out in here?
Right? I don't want to leave, so.
Nope. Change the station if you want that.
Right? No kidding. So yeah, I think that wraps up pretty much everything that we guys wanted to suggest to you guys. But we would love to hear from you. If you guys have something that you think was super beneficial for you or super helpful that we forgot or missed, or you just think we should add, let us know, email us. We're definitely willing to add it to the list that we make for you guys going forward. So yeah, look for that. And then
you guys, we want to make a list. We want it to be available to you to whether you can screenshot it or download it. Utilize that as you're packing.
Yeah. And we also, our goal too is we're going to either do some sort of Amazon storefront or a list of hyperlinks that you guys can just click and go to. So I know the little nightlight that I purchased was not that expensive, super helpful, still use it. So kind of a list of hyperlinks or we said, Amazon storefront.
Yeah.
So that you guys just have quick and easy access to those things.
Yeah. So we can't wait. We hope this episode was just a little bit more exciting this round.
Not so educational. But yeah, so tune in next week, guys, and we can't wait to have some more episodes with you guys.
Thanks for listening.